Max, aged 37, came to me for functional arthralgias, that is, joint pain without any organic cause, affecting many large joints, shoulders, elbows, hips and knees, for the last 6 years. As a background, he had many symptoms belonging to the metal sphere. For example, tonsillitis, rhinitis, frequent colds, dry nostrils and skin pruritus and acne. He also had an hypersensitivity of the Benshen PO, the mood aspect corresponding to the metal movement, which in his case used to manifest in the form of sadness, suicidal ideas, and even occasional thoughts of killing. Max had been in psychotherapy for 3 months, dealing with the anguish and sadness he had felt since childhood. Through such therapy, he had become aware of his enormous resentment, even at times fear of his hidden potential for harmful violence. He used these words to explain these feelings to me. I feel frozen, emotionally blocked, just I feel my body to be. Remember that the reason for his consultation was joint pain. This inner feeling of being trapped was manifesting in claustrophobia, which is logical, in the same way that a person who is cold inside is more affected by the cold outside. The person who has an internal blockage, when he feels trapped in an enclosed space, gets worse. In other words, claustrophobia suggests that there is a compression of energy inside. Max had a sister. As a child, his father never took responsibility for his offspring, and when Max was 6 years old, his parents split up. His mother had to work hard to raise them, so they saw little of her. On the other hand, this woman was a strict, crusty, and rather manipulative woman. As a consequence of such emotional childhood context, Max always had low self-esteem, both with regard to his social mental capacities, the masculine archetype, as well as a permanent feeling of guilt, which is typical of the feminine archetype when he is in deficiency. He cared very much, too much, about the impression he could make on others, to the extent that the fear of rejection restricted his free expression. He avoided expressing himself because deep down he was afraid of not being accepted in case he did so. This was very many years ago, and I began treating his B dampness, that is, joint dampness syndrome, with the common points. First weekly, then fortnightly. After having undergone 18 sessions, his pain had decreased to only 10%. In addition, his anger had diminished, but the itchy skin persisted. Then I decided to go deeper into his emotional discomfort, treating for 6 sessions his liver qi congestion, which calmed just a little bit his irritability. It was the time when I had begun trying a single acupoint approach, and unsatisfied with the result obtained so far with Max, I needled Du-12, Shenzhu. I'll try to explain why I chose this acupoint. Max's pulses were full, Qi, and shallow, Fu. As there was anger but also sadness, I chose Du-12 because it is in the metamera of the Lang back shu point, therefore in the metal sphere, which through its Benshen PO is also related to the mother, as Giovanni Vacciocchi explains. Du-12 is an acupoint that's useful in cases of violence due to a lack of maternal affection. In most cases, this violence, not being expressed, remains compressed inside to the point of making the individual fear that, was it to burst out, they wouldn't be able to control it at all. This acupoint is also related to killing thoughts because Po is the intermediary Benshen between what the text defined as exit to life and entry to death. Well, the result was very clear. Max's anger and sadness decreased considerably and turned, in his own words, into indifference. I did 6 more sessions fortnightly, during which I only stimulated Du-12 on 2 occasions. By then, the pain had completely disappeared, as well as the itching of the skin. Trying to keep his psychic state optimal, I continued balancing his Zangfu for 9 more sessions, combining 2 or 3 points in each session. At the next visit, Max informed me that the rheumatologist had given him a clean bill of health. That same day, I needled Ren Mai 15, a point that nourishes the affective deficiencies of Ren Mai. In my own experience, Ren Mai 15 allows for expression, but does so very specifically when such expression has been withheld for fear of a lack of external acceptance. In a month, Max came back euphoric. He had started a relationship with a colleague at work. Before I couldn't get close to her, I was blocked. He also told me that he was rediscovering sex, the incredible skin contact, the inhibition, the animality, the feeling. I repeated Shenzhu Du-12, and I made an appointment to see him after 3 months. By then, he was very well all over. I punctured Ren Mai 15 again, and we agreed that he would come back if he felt he needed it. I haven't heard from Max for 15 years. I think the interest of this case lies in 3 aspects. Firstly, because it illustrates the possible coexistence of a Zangfu disorder or a B syndrome with a chronic disorder related to the EVs. And there does not always have to be an absolute relationship between the 2 of them. The second reason for interest is that this case reflects the dynamic emotional balance between Du Mai and Ren Mai in the same individual. Finally, the third is to note how the stimulation of a Ren Mai acupoint can have the effect of connecting the patient with the yin aspects, not only their inner self, but their sexuality as well. As a consequence, these acupoints help the individual to open up to others, to express such desires in order to have the possibility of making them real. The materialization being a yin function as well, therefore proper to a yin meridian like Ren Mai.